Good morning, everyone. Welcome to the Clackamas County Board of Commissioners policy session on this June 21st, 2023. Gary Schmidt, County Administrator, you're up.
Thank you, Chair Smith. This first policy session today is Ambulance Service Plan and Performance-Based Ambulance Services Contract. Staff from Health, Housing, and Human Services, the Public Health Division, will present. And they are Denise Swanson, Deputy Director of Health, Housing, and Human Services, and Philip Mason Joyner, Public Health Director. Now, Philip, is this a Board of Public Health discussion?
Yes, if the board could convene as the Board of Health,
Right.
that'd be wonderful.
Chair, would you please do that?
Yes, I will recess as the Board of County Commissioners and convene as the Board of Public Health Commissioners. And folks listening, there are 4 different sections to the proposal today. I'd like to tell you how that's going to go. First, we're going to have a staff presentation, possibly 15 minutes, and we'll let staff present. And then we're going to go number 2 to board clarifying questions. And at that point, I will bring up an issue, and all commissioners, I'll bring up an issue first, and then all commissioners obviously can take the time for comments. And third are stakeholder comments. There's invited guests in the room, and anybody who wishes to opine on this going forward can do so. And I have a wonderful stack of blue cards here indicating that people want to speak on this. Thank you very much. And then the final action, number 4, will be board discussion and action, and we will consider a motion. So, welcome, Denise Swanson and Philip Mason Joyner. Please continue.
Thank you, Chair Smith, Commissioners. I'm going to take a moment. Denise Swanson, I'm the Deputy Director for Health, Housing, and Human Services, and I'm going to turn it right over to Philip Mason Joyner, who is our Director of Public Health for Clackamas County. Thank you.
Thank you, Denise. Good morning, Chair Smith and Commissioners. Today we've reached a really exciting milestone for the emergency medical services system in Clackamas County with a finalized draft updated ambulance service plan for your consideration and a nearly completed final draft of a new performance-based ambulance contract. This work has been hard work and very collaborative over 3 years by our talented county staff, our EMS council at the county, its subcommittees, a national consulting firm, and many, many stakeholders and interested parties that include 12 fire agencies, 2 911 centers, Clackamas County's Fire Defense Board, hospitals, fire unions and Teamsters, EMS medical directors, American Medical Response, or AMR, law enforcement agencies, and more, many of which are here in the room today. So I hope to provide a very brief overview of this complex and technical work at a high level, and then we will take it from there as Chair Smith described. Next slide, please. And that is what I just went over. I'm sorry, Tony, we'll get there. Next slide after that. Just for the public, what is an ambulance service plan? Ambulances are a really critical resource for the health and for the safety of our community. Call volume for 911 medical calls continue to increase year after year, making this a more finite resource as time goes forward. The ambulance service plan provides the framework for how to best utilize these resources while meeting these increases in demand. An Oregon revised statute requires that every county in the state has one of these plans that is approved by their Board of County Commissioners, and an Oregon administrative rule defines all the different elements that are required to be in these plans. Locally, Clackamas County's ambulance service plan is reflected in our county code in Title 10, Chapter 10.01. Next slide. Our current Clackamas County ASA Ambulance Service Area contract is with American Medical Response Northwest. It expires in May 1st, 2024, and is now 9 years old. The existing contract, it focuses on response time compliance as the primary mechanism for accountability. And the process that we've gone over the past 3 years provides an opportunity to change this contract and reflect how many successful systems across the country now operate. Next slide. So in your packet, there is a spreadsheet that contains a list of 21 recommendations that the national consulting firm put together. County staff took this information, we shared it with the county's EMS council, subcommittees, additional stakeholders to get consensus, to gain agreement on what to include in the plan. to what goes in the new contract, or to have, there are some that are staff recommendation to not be included with a rationale for why. It shows some items that are already happening in the county, and it also shows some of the recommendations where they're being implemented, they might be completed, but may or may not be appropriate to be included in the plan or the contract. And I'm going to share the next few slides, a very high-level summary, just a few of the bullets of the really key critical changes, and we'll start with the ambulance service plan. The first item listed here is to a revised process for which ambulance service areas are determined. Our current plan that's been in place for a very long time notes that there are 3 in Clackamas County, the Clackamas ASA, the Molalla ASA, and the Canby, but it's silent on the actual process for how an ASA is assigned and how, if in the future the county ever wants to make changes. So the plan now has a specific and standard formal process for how to do this moving forward. The next bullet, merging the Woodburn Ambulance into the Molalla and Canby ASAs. So this has been a big point of stakeholder discussion, and it's really important to note that operationally on the ground, the EMS response for these agencies that provide services in this geography, it remains the same, but this now assures that there's some level of expectation for data sharing, for reporting, and for monitoring the services that are provided in the southwest corner of our county's geography. The next bullet, adding base BLS ambulances, which is basic life support ambulances. Currently in Clackamas County, ambulances, the personnel is at least 1 paramedic and 1 EMT. The plan update would now allow for 2 EMTs instead of that paramedic to respond for lower risk, less medically complicated calls in a way to free up resources and address some of the workforce challenges that we face. The plan update includes adding clinical performance requirements. So ambulance providers would now be required to monitor and report on heart attacks, strokes, cardiac arrest, and advanced airway. The contract adds performance improvement language. So this is the process for when an agency is not meeting either the clinical performance requirements or the response times requirements. They're put on improvement plans, and now there's a formal process for how that is done. This would also be reflected in any agreements or contracts with agencies that participate in the EMS system. And the last bullet here is adding a health equity requirement, which establishes standards for agencies to provide EMS personnel with continuing education focused on providing culturally competent health care for our community members. Okay, just a couple more bullets here. Bullet number 1, on the next slide, it allows for clinical innovations to happen. So these are innovations such as community paramedicine, the ability for ambulances to transfer to a clinic or to an urgent care for lower acuity calls instead of to emergency departments, for nurse triage to happen, for telemedicine, and more. Bullet number 4 here, I'll note, that's about data platforms, so setting a standard that all agencies must use the county-adopted patient care reporting system, which is called ESO, and our county's adopted real-time surveillance software, which is called FirstWatch. Next slide, please. So that was the plan update, and these are now the changes to the new performance-based contract for ambulance services. As I've noted, the big star of the change to this contract is adding those clinical performance measures to ultimately improve patient outcomes. So now accountability is really focused on response time and clinical performance instead of just response time only as it has been historically. Bullet number 3 is also really significant. It's a revision to response time requirements. This is based on the consultant's recommendations. And this bullet is twofold. First, suburban calls would add 2 minutes for response time, so going from 10-minute requirements to now 12. This is now industry standard, and it has been shown not to have a negative impact on patient quality of care. The second part of this item is to reduce the number of medical call types that are labeled emergent. And emergent calls are those ones that require agencies to use lights and sirens. So this change has been the most time-consuming, but it's really important really helpful to advance our system and use resources more effectively. There are over 2,000 different call types that dispatch centers use, and each of those have to be recategorized and approved by our EMS medical direction team based on these changes. Next slide. Adding level 0 language. So this is a new contract requirement, something we've heard from stakeholders that is really important. And what this means is moving forward, every time when an ambulance provider doesn't have an active ambulance available to respond to an emergency call within the Clackamas ASA, they are penalized. So this is a really important piece of feedback for accountability given concerns about the contractor's organizational growth, high demand for resources, not only in Clackamas County, but across the whole Portland metro region. Bullet number 4 here. I mentioned this earlier, but the contract will note that basic life support ambulance. So 2 EMTs, not requiring a paramedic for those lower, less complicated medical calls to address the workforce challenges. And then finally, the contract also requires that the contractor must use that patient care reporting system and real-time surveillance system. So all that information is centralized in the county. So this is the last slide before I share a proposed staff timeline for next steps and hand it off to the chair for board discussion and public comment. Accountability, 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 and transparency. I think core values of the EMS stakeholders and what folks want to see in the EMS system in Clackamas County. And in the updated plan and in the new contract, staff have been developing a new process for contract compliance reviews and to address that accountability. Clinical and response time compliance with these new technologies that I've talked about, the new web-based softwares that we have now, this can be much more automated on a month and reviewed on a monthly basis. Historically, this has been a manual, time-consuming process, so this is a great advancement for us. There will also be quarterly reviews of this data by management to assure that quality assurance is in good place. An annual review, an annual external review panel will be convened, and this will be a new subcommittee of the EMS Council with local experts to review this data. And then every 18th month, bringing a smaller independent team of folks that are more, they're connected to the EMS system, but maybe have a more outside, less close view of the system at a higher level, including an EMS researcher, hospital folks, community members, just as a couple of ideas there, and really looking at system needs for the future. And of course, at the board's direction, each of these reports, some or all, whatever format the board would prefer, can be shared regularly with the Board of County Commissioner. We're also discussing creating a data dashboard and having this information posted on the county's webpage so that way we're transparent to the public as well. And then my last slide is recommendations, and apologies that it's a little bit small. If you go back one more, Tony, I'm sorry. The table that shows the timeline, staff's recommendations for next steps. So the ambulance service plan update. Today we presented just a really high level overview of the final draft. The draft plan is in the meeting packet today. Our realistic hope is that we can incorporate any changes that the board would like to see. If there's information shared during public comment that you'd like to see incorporated in this work, that could be done in the next month or so, hopefully less, or next 2 months or less. And if the board agrees, county staff could submit a final version of the plan update for board approval no later than September of 2023. And once approved by the board, it then has to be submitted to the Oregon Health Authority for their review. The performance-based contract, we do have a solid draft developed, a similar process where we potentially need some time to incorporate any feedback from today. Then negotiating the details with AMR, which it can take some time because that does have to go through their corporate process. We do have to really go through line by line and make sure that both parties can come to terms with county council. And once AMR signs that, we then come back to the board seeking Their final approval on this timeline is to do it before the end of the calendar year, so that way this contract could begin January 1st, 2024. This is, of course, the direction and decision of the board on the start date of this new contract. Our recommendation is to start the beginning of a calendar year. It just makes it easier, I think, to do that. But ultimately, no later than May 1st, that is when the current contract with AMR, May 1st, 2024, it expires. So certainly have to take some action before that time.
Right.
That is my presentation. Thank you very much.
Thank you. I would like to start off, Commissioners, with something that came to our attention, and that is the slower response times and what the contract allows for. Can you address what those were and the proposed action that the EMS Council and Public Health wanted to do?
Yes, I'm happy to start, and I'll look to Gary and Denise to help. So we know that response time compliance is the primary mechanism for accountability of the existing contract. We're in year 9. County staff did complete the 9th year of reviewing all the response time requirements for AMR, and there was concern about them not meeting their response time requirements in the last calendar year.
Last calendar year. Which is what?
May 1st of 2023 to April 30th of, oh, sorry, I'm getting that wrong. Help me out here. It was May 1st of 2022 to April 31st of 2023 this
Okay.
year. So as I said, it takes county staff a long time to do the analysis of this data. We did discover that AMR was not meeting the 90% response time requirements for several of the months. So that does, the contract does require the enforcement of liquidated damages or penalties to address those non-compliance issues.
And what was the action taken by the EMS Council because those response times were not met?
This was done by, to clarify, by county staff in public health. This was not shared at this point with the EMS Council.
And what was the county staff, public health, what was your response to the slow response times?
We provided the information on the dollar amount to the Board of County Commissioners and provided AMR with a letter related to the fees and placing them on a performance improvement plan.
And how much was the fee, total amount?
$456,000.
$456,000, of which you recommended that they be fined for. And commissioners have had some discussion about that. And what we have learned, and whether this is true or not, because AMR, please get ready, you're going to appear at the dais next. And my statement was, yes, that is a contractual agreement that they agreed to. If they do not meet response times, they will be fined. However, my question is this: how does finding a company more money increase the response times of which we all want? When our citizens call for an ambulance, they want them right there, because it's usually an acute situation. And the people don't know why, or why their person has fallen, or looks like a heart attack, or any other type of injury that may happen. So this commission did some really thoughtful thinking and consideration of that. And what had come out of the discussion was quite possibly a workforce shortage. Can you attribute a workforce shortage and or maybe lack of qualified people equipped in ambulances as the reason for delayed response times?
Would you like AMR to answer that, Chair?
Yes, but do you have an answer?
I certainly think in Clackamas County and nationally, the workforce challenges are very real on the street, and private ambulances are struggling with the workforce challenges to have qualified personnel available to meet, just like the presentation showed, to meet the increased number of calls in communities and be able to effectively respond within those criteria.
Okay.
Absolutely.
Thank you, Denise and Philip, for coming forward. I'm going to ask Randy Lauer and your team to come forward. Would like you to address this issue,
Madam
please.
Chair, I was
Yes.
just wondering if maybe the questions I have for these folks, we can ask now.
Well, what I said in the beginning is I wanted to address the response times first, and then we're going to have them come back with commissioner questions on the other issues. But thank you, Paul. You will be heard. All the commissioners will be heard. But I want to address the response times first because that seems to be one of the overriding issues that the public is looking at right now.
Well, good
So,
morning.
welcome.
It's good
Please
to see
introduce
everybody
yourself.
in person. Randy Lauer, Vice President of Operations, American Medical Response.
I'm Jason Mayo, Operations Manager for AMR in Clackamas County.
So you have it right. There's a national paramedic shortage, and there's a national healthcare shortage coming out of the pandemic. So EMS has not escaped that. We're short probably 2 or 3 paramedics right now. We're trying to address this on a longer-term solution of, we've got a number of EMTs in paramedic school. But that's a 2-year process, but they've
Right.
been in for a while. We have some EMTs graduating paramedic school in September, so the first class is coming out. So we see a good kind of a light at the end of the tunnel. But the last 2 years, the paramedic shortage has affected everybody across the United States, and we've not escaped it.
At the peak of the decline in response time in Clackamas County, we were down about 20% of our paramedics in just Clackamas County.
What about EMTs?
EMT is not so hard to recruit. There seems to be quite a few people, but for whatever the reasons is that the paramedic schools shut down for a couple of years during the pandemic. And a lot of people just didn't want to get into healthcare after the pandemic, so it affected our whole society that way. So I don't know that anybody projected it would be as intense as it is, but this is the worst paramedic staffing I've seen in my 42 years here by a long, long way.
So does AMR have your own training center?
Yes, we do.
Okay,
It's co-located at our building in Clackamas County.
okay, and there was an email that was sent out, Commissioners, I'm sure you have it, on the amount of time it takes at Clackamas Community College and Portland Community College to educate EMTs. There's different categories. EMT no certificate, 9 months. EMT certificate, 1 year. Paramedic certificate, 14 months. And then you add on, now this is at the college level. Does that parallel with what you offer at your organization?
If I understand your question correctly, I think the answer is yes.
Okay.
Jason might be able to address that better. You're closer to the.
I think the difference between the certificate and the other one is the certificate program is for people entering paramedic school that already have a 2-year degree, and the other one is for people that need to get their 2-year degree out of the program.
For paramedics?
For paramedic, correct,
Yes.
because the state of Oregon requires a 2-year degree to be a paramedic.
Okay, okay.
Only 1 to 2 states in the country, but that
Oh,
require an
oh,
associate's
geez.
degree, but that's a
We're the
2-year
only
process.
one of 2 states in the country that requires a 2-year whatever degree to become a paramedic, and that may be an issue right there.
Yes, it is.
Okay, all right. And then, Commissioners, we did discuss the fines going forward, but Commissioner Savas, you're up, and then Commissioner West.
Yeah, I thought, just kind of stepping back a little bit from this particular conversation into, why we're here and what we're doing, consistent with the packet, I wanted to get, I know we have 2 commissioners on the dais here that have never been through a contract renewal and are new to this, and I could always use a refresher as time goes on, and I had a lot of memories of the last episode here, if you want to call it that, here several years back. Thank you for all that provide services on behalf of the public and your public service. Appreciate everyone here today for what you do on behalf of people that are in need. So I just want to get that out there out front. Philip, in your presentation, you brought up the Canby Malala ASA, which is now provided by Woodburn Ambulance. And I'm assuming that this whole effort that everyone's gone through with the EMS Council and review and this whole new upgrade for how we provide ambulance service, the ambulance service plan and all these things, it applies to the entire county, right? Not just the portion AMR covers, is that correct?
Correct. And in the current ambulance service plan, Commissioner, there's that southwest corner of the county. It was actually stated that there was an MOU between the county and Woodbury Ambulance for Woodbury Ambulance to cover that. So this changes the zones or the areas that are covered by that small piece of Clackamas County now.
And I don't think we ever, as a board, ever really discussed the MOU and the status of that, and also about how they're meeting their standards as well. I'm sure they're having the same staffing shortage. So when do we engage that part of the county, at the same level as we are with the contract? I don't want us to forego our responsibility, or we're not going to abdicate our responsibility, but I just want to let the people in Canby, Molalla, and areas in between know that we care about them just as much as everyone else, and response times in rural areas are more significant than they are in urban areas. So to me, it's a heightened concern that I have, and we've never discussed it.
Yeah.
Never on this dais.
And I hope I can alleviate some of the concerns. We have engaged Woodburn Ambulance directly, Monitor Fire, Aurora Fire, Canby and Molalla. Leadership have actually met with county staff and those agencies, discussed this in quite detail. There was concern. The concerns were addressed and mitigated. One of the things that was helpful to the agencies is to know that the response when the 911 call comes in, it will still be the closest available resource will still respond. This will not negatively impact response times or things like that. But what it does do is it brings that geography into the system formally in Clackamas County through our 3 ASAs. Right now, that's operating independently. The county does not receive data. We don't receive information on how response times or any other services are being provided. So now this brings that geography into the fold formally within the county. So there's transparency for everyone. I think it'll be value added to the public ultimately.
Okay, you said 3 ASAs, so Canby and Molalla are each one?
Correct.
Okay, how about the areas in between?
The rest of the county is covered by the Clackamas ASA.
So the geography between Canby and Molalla is AMR's coverage?
Correct.
Okay. I just have more of a systems question. Maybe it's to AMR folks here. Is there any sharing, like if there's a call, is there any cooperation with Canby and Molalla providers when there's a call?
Yep, we back each other up quite a bit.
Okay.
Just depending upon the tempo in the different ASAs. But yeah, there's a pretty healthy flow of resources across the ASAs to back up when necessary.
Does that hold true for the western part of Clackamas County and the northern part of Clackamas County where it enters Multnomah County and Washington County? Is there mutual sharing?
There is. The difference with one caveat, Multnomah County requires 2 paramedics. Washington County, Clackamas County adopt the state and national standard of a paramedic and an EMT. So units from Clackamas County and Washington County cannot provide mutual aid into Multnomah County, but the other way can happen.
Okay. All right. So, Philip, back to when do we foresee that engagement with those other 2 ASAs? Is that in the horizon?
The 2, Molalla and Canby ASA have been involved directly. They're fire chiefs, they're heads of their EMS. In fact, the Canby EMS division chief is the chair of our EMS council. So they're fully integrated and been part of all of this work from the onset.
Right. Well, I meant was contractually.
Oh, contractually. At this point, the board has only chosen to enter into a private contract for ambulance services and for the Clackamas ASA. Ambulance transport for Molalla is assigned to Molalla Fire District, and for Canby, it's Canby Fire District. The board has the legal authority to make a change. That is not the staff recommendation at this time to change that.
Okay. Well, maybe, I don't know if it's a conversation for today. If it's not today, I don't know when, but let me just, the MOU that you mentioned earlier, reference the MOU, is that an MOU between the county and Woodburn Ambulance, or is it an MOU between the county and the fire districts individually?
It is between the county and Woodburn Ambulance.
Okay.
But
And-
I will say that MOU is very historic, hard to find, and not really in use. So
Okay.
that is why there's a need to make this change.
Okay. Well, I think it's incumbent upon us to not, again, abdicate or have a situation, and I know it's not deliberate, but I think we have the responsibilities countywide, correct?
Correct.
Okay, I'll just leave that there. It's a county responsibility, so I just want to make sure we're addressing it in a responsible way. And if that's done contractually, great, but I think we ought to have better insight into what those arrangements are and how that's done. So all the recommendations for the changes are going to apply to the entire county and those 3 ASAs.
Correct. So the response time requirements that are in the ambulance service plan update, the clinical performance metrics, and all the other highlights that I walk through are for the 3 ASAs in Clackamas County. So that would be inclusive of Malala and Canby.
Okay. That's what I have for questions at this time, Chair.
Thank you. We're going to address the response times. Commissioners, please stay focused on that, and then we can open it up to other questions. Commissioner West.
Thank you, Chair Smith. Hi, gentlemen. Good morning. It is awesome to see so many first-time responders with us today. I appreciate you guys. I enjoy working with all of you in healthcare, and this is my first time going through this contract process, but it has been a good experience. So I have questions around workforce issues initially here. When I was looking through the notes and I did see associate degree to practice as a paramedic, I literally highlighted, circled, and I was a little bit kind of like curious about that. Is it your opinion that a 2-year degree piece of paper makes a better paramedic?
There's a mixed opinion on that. Personally, I think it does, because it provides kind of some basic college level courses that a lot of what we do is we document the care we provide. So it helps people document better and things like that. I don't know that it's a huge difference, but I was a proponent of a degree program when it started years ago. And when we had this discussion lately, there was actually a bill introduced in the legislature that would take the associate's degree away. It never made it through committee, but there was a lot of opposition. There were a lot of course, the colleges, but a lot of the professional groups, a lot of the fire service, the unions all believed that we should retain the degree. So I would say there's probably more than half of the people thought we should keep it rather than get rid of it. But there's a secondary process that's going on now, because what that did, that Senate bill, spurred the health authority to stand up a rules advisory committee to look at the rules around provisional or transitional licensure, and that advisory committee is well through almost through their work now, and I think that's going to provide some relief. So what it would do is it would give a paramedic coming in from another place who has national registry but not a degree, would give them, I think they're talking right now about 4 years to obtain the degree. And in the meantime, they'd have a provisional license, and I think that will work pretty well as a kind of an intermediate stopgap.
Thanks, Randy. That gets to my second question is, I became a nurse through community college. I went through the 2-year program. It didn't take 2 years because there was a lot of prerequisites. It took more than 2 years. It's 2 years once you're in the program. But as a working adult, I went back to school, became an RN, then got my bachelor's, then got my master's. I kind of went through the whole process, right? So I am acutely aware of the students that I used to go to school with, especially working on prerequisites that wanted to be paramedics. And I remember that anatomy, physiology 1, 2, and 3 were required, which are beasts of, they're rough, right? And sometimes that's the only class you're going to be taking because it is almost like a full-time job to memorize that much and to get that familiar with the human body anatomy and its physiology. There's college psych course classes required, communication courses required, college writing courses required. And so there's a number of prerequisites just to be able to say, yeah, I'm going to go to work on the paramedic stuff now. So I guess my question to you is it really only do you guys find that most students really get through this in 2 years, which makes it more affordable, but it also seems like it's actually quite a bit longer than that, which can make it challenging for workforce issues just to get qualified staff out in the field?
I think they get through in 2 years pretty well. The only thing that might delay that is an internship. There's a field internship that's the last phase of paramedic training, and that kind of relies on responding to a certain number of different types of calls. So it's not a prescribed time, it's prescribed experience, I guess would be the way to look at it. So that could maybe extend it past 2 years a little bit, but probably not too much. 2 years it's been pretty reliable.
And the certificate process is you already have your degree in whatever. So you can check that box, so you have a little bit of an easier pathway or quicker pathway to the goal of paramedic, am I right?
Correct, and I believe there's also a grandfather clause. If someone had been a practicing paramedic in another state for 3 years,
Okay.
they would be grandfathered in as well.
Okay, and then is it easy for, let's say, a nurse who says, I want to be a paramedic? There is so many parallels within like a nurse and the ED, and basically in not quite the same scope of practice as a paramedic, right? But let's say, I'm just going to use it as an example, a nurse that's worked on med-surg for a couple years, or a nurse that's been in the ED a couple years, and they're like, gosh, I think I really want to be more in the field. This is appealing to me. And they make a career shift. Is there an easy glide path for other like professions to go and be a paramedic and to move back and forth if necessary?
Well, no, if you're really interested, we are hiring, Commissioner.
I'm a full-time chef on a diet. Yeah.
I'm not sure if it's still in place, but I think an RN with critical care training could staff the paramedic position or the lead position on an ambulance.
Okay.
I'm not sure if that's still the case, but I know it used to be.
Okay. And then how many paramedics do we need in Clackamas County to deal with these calls? How many EMTs and how many paramedics would you love to be like, flip the switch today and you got them and they're working?
Yeah, we're currently down 3 paramedics and 2 EMTs.
So how many total do you need? Just
total.
Full staff?
Not just like to be,
I see your
but like
question, sorry.
we want to be,
Yeah, we
need to be
need
here, not-
47 paramedics and
Wow.
with the current staffing, 45 EMTs.
You need additional?
No, that's our total. If we were
Okay.
completely fully staffed, that's what we would
how
have.
many do you have now?
Now I have 44 paramedics and 43 EMTs.
So you're almost fully staffed?
Close.
Not too far away.
So,
At the peak of our staffing challenges, we were down 11 paramedics in Clackamas and 7 EMTs.
let me understand, let me just, do we not have a staffing shortage really in Clackamas County? We're close, we're almost there.
We're getting
You're getting there.
We're getting
You've been
close to
working on
being
it.
back to our core, we call our core schedule.
Okay.
But we want to deploy every day. Plus, we usually like to have a few we call travelers who can
Yeah.
work any unit. I mean,
And so do you feel
nursing
like
has
if you
those too.
got to this 47 and 4, you're always going to have a few, right? That's just attrition, people come and go. You're never going to be always fully staffed, right? You're always going to have a few positions. So would it be safe to say that we should be able to have a better, starting like now, better response times based on the students coming into the field and that you guys are basically fully staffed? Should we immediately start within the next year, be like, we can see the response times better now because you guys have worked so diligently on this issue?
Jason can answer that, but that's what we believe, that's where we are. We're in a recovery phase with
Okay.
staffing, and we're not quite there, but we're getting really close.
Getting really close,
Our-
okay.
Our intention is to be fully response time compliant.
Okay.
We don't like being below compliance.
Why would a new grad choose your company over a competitor's to work at?
I think there's a lot of opportunities for people in various things that we do as a company locally and nationally. I mean, people have the opportunity to go on hurricane deployments, wildland fire deployments. They could become a member of the Wilderness Reach and Treat team, could be on the River Safety Program. There's lots of opportunity for promotion into leadership. So I think there's a lot of opportunities at AMR, and I like to think we have a culture that is welcoming and, friendly.
Okay. And then I guess I think that is all my questions regarding it. So I have more. I'll reach out to you, Randy. Thank you again, both of you, for answering those questions for us. Thank you.
Thank you. Commissioner Scholl?
Yes, good morning. Commissioner West's questions answered some of mine, but the question here now is response time, and you're working on resolving your personnel shortages, but 47 TO and 44 on-hand and paramedics, 45 TO EMTs and 43 on-hand is not a drastic shortfall. So tell me, with the basic life support ambulances with 2 EMTs and the potential to reduce utilization of ambulance vehicles for non-emergency purposes, using those 2 tools, would that help also reduce response time between now and May of next year?
Yes, and if you remember, the period that was measured was through April 30th of '23. So that was when we were probably 10 or 12 paramedics short back in that period of time, and now we're 2 or 3. So we are getting better. So I believe that our response times, like in June this month, or May and June, are improving.
And how close with that improvement does it bring you to contract requirements for response time?
How close to 90 are we in June?
A lot closer than we have been.
89 or?
We're about 85 right now.
Okay, so it's getting better.
85 out of 90. Okay. And one more question. With your training, the people in your training pipeline currently, will that bring you to where you want to be for your on-hand personnel by May of next year?
Yeah, I think so. And that was it's the longer solution. We did a lot of bonuses and incentives and things like that to try to attract people, and as was everybody. And that's kind of run its course, but there just aren't enough paramedics for everybody. So, but when we started investing in scholarships a couple of years ago, and those are going to be graduating here, those students be graduating pretty soon, that is probably the real recovery from staffing, because that's what started the problem when the schools shut down, and now when more people are coming out of the schools, that should help us recover from the problem.
Okay,
So
one more question, and that is, every company wants to grow and expand and increase your potential for profit. Recently, AMR took on a contract with Washington County. Now, tell us, and of course that's your prerogative to do that, but how did that impact response times and personnel staffing for Clackamas County?
It did not, and it has not started yet. It starts August 1st.
Okay. August 1st, can we anticipate yet a reduction in that 85% you've achieved in the last 2 months?
No, and
Okay.
actually the direction I've given, or the request I've made of Jason is to get fully staffed. I mean, if we can probably do some internal changes that could get us those additional 3 paramedics, and that's what our focus is on Clackamas County. We're not at all planning on taking on another county at the expense of a current county we serve.
So what I've heard so far, I'm not seeing any monster crocodile of a problem here that's not been addressed yet. You've got your staffing problem being addressed. You're doing what you can to reduce unnecessary dispatch of ambulances when it's not really a life and death situation. Is that correct?
That's correct.
Okay. So, okay, it seems to me like you're doing what you need to be doing, and we have a relatively high expectation potential for you meeting that 90% contract requirement
Yes,
real soon.
yes.
Okay,
I think
thank
we're
you.
getting very close.
Okay. Yeah, I have some follow-up questions, but we have another commissioner in the queue, Commissioner Schrader.
It's nice to see both of you here
Morning.
today. When I was a new commissioner, I walked right into the middle of an ambulance contract. And my two colleagues said, well, you can handle this. And it was pretty difficult, folks. There was a lot of strife. We had to work very much more closely with not only AMR, but with our responders in the fire service. So I was just asking, how has that been working for you guys? It seems as if now it's really, everybody's coordinated, everybody's really responding together and working very, very well together.
That's my opinion, Commissioner. It's, and the Cambridge Consulting Group who the county hired, I mean, early on, they made that comment that there's so much collaboration in Clackamas County and everybody gets along so well, and they were surprised. Well, they're from the East Coast, so it might be different there, but they were surprised at the level of collaboration.
Good.
That's good to know, because I remember at the time, we had worked very hard to make that happen. I literally visited every firehouse in the county at that time, trying to see what the rubs were and what touch points there were for collaboration, and you have really done an outstanding job. And really, I think, colleagues, what we're faced with here with staffing levels, this has just been because of a national crisis, because of, I think, of what we've experienced the last few years with medical issues, COVID in particular. I do think that it was a big shock to our medical system. I had an opportunity to speak with, Philip and I went to see all the major healthcare providers, Systems, Legacy, Providence, Kaiser, and they were really very upfront, saying they were experiencing the same thing with shortages with nurses, with burnout, a tremendous amount of strain on their mental health systems, because people would come in crisis, and where could we move them to after that? So this is kind of a systemic issue across the medical field, I think, and Ben, you would know better than I, but that's my larger observation. And I just want to thank you for working with us all these years, and it's always been a pleasure to have you here. Thank you.
Thank you, Commissioner Schrader. I want to follow up on a couple questions that you mentioned. You give scholarships for your training for either an EMT or a paramedic, and I assume the caveat is they go to work for AMR.
Yes.
Yes, obviously, they're not going to flee to another company. What percentage of their training is a scholarship?
100%.
Is it a full ride?
It's a full ride for paramedic school. And we have some diversity scholarships too, where we actually recruit from high schools and start them in EMT school. And then they go on to paramedic school.
Okay.
And we have the first two of those graduating this year, so that's
Really? Do
pretty
they get
cool.
their associate's degree along the way?
Yes,
Good, good for them. That's a lot of work.
yeah. So it's about, the paramedic part's about $17,000 a year now with tuition and books, and that's what we fund.
Yeah, I'm glad that wage is that way. Okay. What, you say you need about 8 EMTs and paramedics to be fully staffed. Does that account, because you need 3 paramedics and you need 5 EMTs? That's 8 in my math. Okay. What about attrition? What about reserves? Do you have backups for that? That's your fully staffed, but then what happens to somebody if they get sick, or all of a sudden they quit, or have you accounted for retirements? So I would think you would need to keep training and have people in the pipeline.
That's a very good point. So yesterday morning, I met our new orientation group in our Clackamas building, and there were 29 people in the class. The biggest class filled the classroom, one of the biggest orientation classes I've seen in over a decade. So that was very encouraging. It's a mix of paramedics and EMTs.
Okay. And to reiterate, how much time do you need to become fully staffed?
That's a great question. In a perfect world, it would be tomorrow.
Okay. If this board was to say 1 year, knowing what you have in the pipeline, knowing what could be coming in, would that be an adequate amount of time for you to report back to us on your staffing levels?
I believe so. I mean, if
I mean,
no
I'm not going to
other,
hold you to that because I understand the variables in it, because we experience the same thing in Clackamas County. We have some workforce shortages. We're always putting out job applications, hoping to get qualified people to come work. So what if you had 1 year from the time that, for instance, today, since we're having this conversation today, would that be an adequate time for you to gear up? You are geared up, but even more so to meet the requirements of the contract.
I believe so. If you look at where we were a year ago and how far we've come,
Right.
and then how much farther we need to go, we've come most of the way. So I think a year, think we could safely say in a year, absent another shoe dropping somewhere, that we'll be
Right.
fully staffed and
Well, we
fully
can't
compliant.
predict the future on future events. So how many years were you in violation of the contract with slow response times?
We'd been fully compliant with response time penalties until this last year.
Okay, so it's just 1 year? Okay. And did you count response times during COVID?
Yes.
Yes.
So even during COVID, you were able to meet the response times?
It was a unique thing. When COVID started, our call volume dropped almost overnight by 35%. So we were well overstaffed for a long time, and then it shifted to the totally opposite direction.
Okay. Commissioner West, you're up.
Thank you. A couple more follow-up questions. What does a staffed ambulance look like? Who's on it? What is the licensure requirement? And how do we make sure we go to the full scope of someone's practice so that we're being economically responsible with their resources? That still, through an evidence-based lens, gets the best outcome for the person that needs emergency medical care. And so, where does this model vary within the region?
So an ambulance in Clackamas County be staffed with what we call a lead paramedic. So it's a paramedic typically with at least 2 years of field experience who've gone through a third phase in field training to become a lead. And then working with an EMT that will have a various level of experience from anywhere from a year to, probably 15 years. EMTs also go through a field training program before they're put on a 911 ambulance. So that's what the staffing picture looks like, that paramedic with at least 2 years of experience and an EMT that's had a field training program. And then the ambulance, of course, is equipped with all the things, all the bells and whistles.
So we have in Clackamas County 1 paramedic and 1 EMT at least.
At least. And then the fire service in the urban area has paramedic level first response. So there's typically at least 2 paramedics on the scene of every call, at least in the urban area. If you get way out rural, that may not be the case, but.
In Multnomah County, though, they take 2 paramedics.
And there's fire department paramedics
So
too, so there's 3
they're
or
gobbling
4.
up some local resources. In Clackamas County, is that level of credentialing necessary to have a safe and competent response?
I think so.
Are we lagging because we don't have that same
No.
professional, credentialing on our ambulances?
No, because it's, Multnomah's the unique one. Clackamas is kind of one of the normal ones. The staffing
many ways.
requirements are
So many
the way
ways.
they are around the state and the country, so.
Yeah. Okay. What does a new EMT make, and what's the pay scale to an experienced one? And then what is coming out of school versus, you're an experienced EMT versus a paramedic and an experienced paramedic, and what's the differences in their scope of practice?
So I think it's the range for an EMT is like 40 to 65. And then for a paramedic, I think they start at high 40s and go up to like 100 and just over 100 now.
So really similar to an RN.
Getting
A
close, yeah.
paramedic, is now similar to an RN. Okay. And what's the difference in their scope of practice?
The scope is, so anything cardiac, medication, so pharmacology, anything cardiac, respiratory, an EMT basic can't start an IV, for example, a paramedic can, and there's an intermediate level of EMT as well.
Okay. And
so
are they
the-
all ACLS certified for cardiac response, and then your EMTs are basic life support?
They go through the multi-agency training we all do together. So we do that on a routine basis with our fire partners. And that's, I think, one of the reasons why there's so much collaboration is we train together. So when we get on a call together, we've already practiced how to handle that.
Do we pay for and help our staffing to retain them, do additional education and certifications within the practice? So like for nursing, if I wanted to get my certification in heart failure certified or med surge or immediate ICU care, I can get additional training and specific specialized certifications for my career. When employers help with that, I know nurses tend to be much more loyal and rooted to that hospital system if they're helping advance career. Is that offered within this career field too, that we're making sure that people have educational experiences to have that fulfillment and better practice moving forward?
I'd say nursing probably has more options available. Paramedics, there's a few places they could go. I mean, Dr. Sani directs the education and the ongoing training, but you could become a critical care paramedic potentially and work on a specialty
Like
care.
flight.
Yeah, you could become a flight paramedic, but there's not probably as many avenues as nursing has.
Okay. One last question. Are we recruiting from the military? Do we have a number of young men and women coming out of the military that come ready to go within this field, and they may want to continue the work, in their communities?
Yes, and we're still, we got to work through some bridge training because military medical training is more trauma-focused.
Okay,
So the medical aspect of it is usually some additional training we need to do.
perfect. Thank you for answering my questions.
Sure.
Commissioner Savas, and then we're going to move on to the next phase of this discussion. Thank you.
Yeah, appreciate that. Well, that's what I was going to just kind of mention. I really appreciate getting the update. I was concerned, I feel far more reassured that we're on the repair, on the mend. So thank you for being here. But I know there's a lot of people that sign blue cards and the packet and while we're actually here. So I was hoping to, again, I value everything and you answered a lot of questions for us. So thank you.
Thank you.
But I did want to get back knowing that we only have a half an hour left and, to talk about the.
And that's what I'm trying to do, Commissioners. So I'm going to ask that your comments be brief going forward. I have several blue cards here coming up, but however, we need to take a moment, thank you very much, Gary, for an important piece of business regarding the $456,000 fine that was wielded against the AMR. Commissioners, we have discussed and I will entertain a motion that we cut the fine in half to $228,000, and that half of the total liquidated damages to Clackamas County's cost-saving fund, system enhancement program to support implementation, and also the other half of the liquidated damages will be funded to AMR, will spend the money to support the workforce recruitment efforts and additional strategies identified in the report. So this is the thinking of some of us. I was struck by the fine, and I understand that's in the current contract. And I suppose we need language in the contract to make sure there's performance. I understand that. But I also feel the medical field and our emergency services have been hit hard with workforce issues. I don't know that they're going to go away tomorrow. I think it's going to be a longer road to recovery on this than quite possibly a year. But I'm going to recommend that this money goes into funding current EMTs in your program and paramedics at your discretion of what you think needs to be supplied to help the people of Clackamas County. I am really not sure, we haven't heard from the public on this, but the public wants, when they call 911, they want a response. And by finding somebody for not showing up, it doesn't make sense to me. However, if the response times are not up to snuff, or if they still lag behind, this board has the option to go back and revisit levying the fine. and we'll listen to what has happened on that. So that's where I'm at today, Commissioners. And then I have several blue cards I'd like to hear from folks. Commissioner Savas?
Yeah, Chair, well, I'm not aware that we were going to do that today, so this comes as a little bit of a surprise, actually. I do know that we did discuss the contractual matter in executive session, but I don't have a staff recommendation or a motion or...
Actually, there's a letter that was sent to your email, Commissioner Savas, this week, and every commissioner got it. I assume the commissioners knew.
I have this,
And
and
it's-
I have the packet.
No, with that other one, it was 2 attachments on a PDF form with the staffing requirements.
It looks like this, Paul.
Yeah, we had this coming forward. I assumed all commissioners knew it was coming.
Okay, well, was that in the packet that was that was posted on the website?
It was not on the staff report, no.
Okay, that's where I went to prepare for the meeting today.
We always need to pay attention to our emails because it's good information, and I believe we did do that, but Commissioner Savas, would you like to make a comment?
Well, just to say that I'm just perusing this, this letter that you're bringing my attention to, but it has nothing to do with us taking action today or a
Actually,
motion.
I do think it does, and I do think we need to address that going forward. Commissioner Scholl?
Yes, okay, Chair Smith, I heard your recommendation, but I don't quite understand it. Let me ask you, the fine was $456,000, and you're suggesting we cut the fine in half to $228,000? So that would be the fine to AMR, and what I'm not clear on is the remaining $228,000. You wanted to use that much
Gary,
money
would you
for,
address-
you want to use that money for training,
Yes.
but are you suggesting that AMR spend that much money on training? Okay, is that the deal?
Yes. Gary, would you please explain that?
Yes, so what
Yes.
I'm hearing, and you had a discussion in executive session, which we don't talk about, but you talked about themes like this as well, is that of the fine of $456,000, $228,000 would come to the county for the county's cost savings fund, part of the contract with the EMS. And the second half, AMR would retain, but you're asking them, directing them to use that money for training, education, and getting fully staffed and educating and training those EMTs so they can hit the ground running. That's what I'm hearing you say.
Is that correct?
Yes.
Okay, so AMR, you're spending roughly 200,000+ already a year on training? Is that correct?
Probably,
Okay,
I don't.
so AMR shouldn't see this as a real impact on them. So I concur with your idea.
Would you like to make a motion?
When you're ready, I certainly will.
Go ahead.
I move that the $456,000 fine from the recommended contract amount be reduced to $228,000 fine with the ask of AMR to spend somewhere in the neighborhood of $228,000 on training in the next year.
Okay.
Is that,
Yes, that's fine.
okay, thank you.
Do I hear a second?
I'll second. I have a question in discussion.
Yes, a motion has been made to reduce the fine to $228,000, and AMR is to spend that on training and recruitment for the workforce shortage, and Commissioner West to second that. Commissioner West, you're up.
Some clarifying questions. We did discuss this in an executive session at some length as we do for contract issues. My question is, just to clarify, total fine was $456,000. The county, due to extenuating circumstances outside of AMR's control, is willing to forgive 50% of that. The other 50% will be still levied, but those fines will go towards supporting for training, education, and recruitment. So there is still a fine being levied. It's not from existing dollars, am I correct? You guys are going to reinvest those dollars to deal with the chronic issue of recruitment and employment issues. Am I clear on what we're doing
I
here?
think that was well stated.
Okay, so I just wanted to make sure, and is that's basically what the letter here says from staff. So, yeah, I guess that answers my question.
Okay, further discussion. Tony, would you please take the poll?
I'm sorry, Chair. I'm hearing you say different things here, Commissioners.
Okay.
And so I'm confused, so I want to clarify. You're fining AMR $228,000 that's coming to the county. They are paying us $228,000 that goes to the EMS cost savings fund as identified in the contract. Is that true or not?
That's true.
Okay. And then the other half, you're forgiving that part of the loan or the fee, and that's up to AMR internally to do your training education on their side, right? That's what I'm hearing you say, but I'm not sure.
In the amount of $228,000.
Okay, the letter is somewhat confusing because Gary, yesterday I took you the letter and I asked for clarification and you said this was okay.
Chair, do we want to do this? Do we have to do this today? I'm still unclear about exactly what's going on.
You want to bring back the motion later for more clarification? It's up to the maker.
Please.
I will second that.
Well, it's up to
Is
them.
that how it works?
No, it's not how it works, Commissioner West. It's up to the maker of the motion,
Okay.
which is Commissioner Scholl.
I would be willing to delay the motion to provide for more discussion.
Okay, we can do that. But I do think there's the intent out there,
Yes.
not to punish somebody for a situation that they had no control over. And you second the modification to the motion.
I will.
All right.
Yeah.
So essentially, it's withdrawing the motion until next week,
That's correct.
just to be consistent with Robert's rules. Thank you.
All right, okay, we can do that. Do we need to vote on that, Gary?
No.
All right, we're going to go forward with, thank you very much.
Thank you.
We're going to go ahead with public communication. We have several cards today. And first up is Dr. Ritu Sani. Please come forward, state your name, your area of residence, and you have 3 minutes. I'm going to ask folks, please, to try to adhere to our time limit because we have a lot of people who want to talk. And you all know this issue very well, and I'm sure you can articulate succinctly. Thank you, Doctor. Please go
Never been
ahead.
accused of being succinct, but I will try. Good morning, Commissioners, Chair Smith. My name is Ritu Sani. I live in Lake Oswego for the next few months, and then I move to Wilsonville. I am the county's EMS medical director. I will have been that role for 10 years now, and I just realized that I will have been Lake Oswego Fire's medical director for almost 20 years. As a county medical director, my role is basically to provide the education training, and I'm ultimately responsible for the healthcare that's provided by our EMS system as a whole. Directly, I'm the medical director for AMR, and then contractually through Lake Oswego Fire, Clackamas Fire, Sandy Fire, Clackamas Communications, and Lake Oswego Communications. And our team of medical directors, Dr. Turner and Dr. Kofed included, also help provide that care. I just wanted to step up today to provide my support for this process and support for the hard work that's been going on since at least 3 or 4 years now. I think the key component to this proposal is the switch from a response time mode as the only real requirement in the contract to a number of clinical requirements. Now, the reality is that we provide outstanding care already in our system, and our quality improvement processes identify that. And we're very proud of the care we provide in this county. But what this transition in contract will do is it will sort of codify and really create a very explicit set of expectations around the fact that it's not just what either you get wheels to a location in a certain amount of minutes, which actually doesn't impact patient outcome as much as we'd like to think it does. But the care that's provided once the EMS crew is involved is really what impacts the patient's outcome. And we want to have financial incentives and contractual incentives to move in that direction. So again, even though I think we provide outstanding care now, I think this would serve to only further that mission. Providing this service as a team, and much like a football team, we either get better or we get worse, and we want to be better tomorrow than we are today, and this kind of contract allows for that. So I appreciate your time, and if you'd like to ask questions, I'm not sure I'd want to take them.
Thank you very
but-
much for
okay.
coming forward. Up next,
All right.
Nick Brown, please come forward, state your name, your area of residence, your title, and you have 3 minutes.
Thank you, Chair Smith, Commissioners. Nick Brown, Fire Chief, Clackamas Fire, and I live in Damascus, resident as well. So I speak not only as a fire chief, but also as a resident of Clackamas County. I think there's a word that I want to hit on here, and that's collaboration. What Director Mason Joyner presented was collaboration. I think it's the 12 fire agencies, AMR, multiple law enforcement agencies, multiple hospitals, and Clackamas County staff. I think that's something that needs to be celebrated and is pretty amazing, the body of work that's happened in the last 3 years. Clackamas Fire, as well as myself, on behalf of Clackamas Fire, supports the collaboration, of the strategic plan task force, as well as all the stakeholders, and the body of work that was completed with the Cambridge Consulting Group. The consultant team brought forward a national lens. As a county and as a region, we siloed. And bringing forth that consulting group helped us get outside of our silo and look through a national lens, helping us to create a modernized EMS system. And Clackamas Fire supports the integrity of that process. As Director Mason Joyner stated, it's important that we implement a modernized ambulance service plan and ambulance service agreement that's reflective of not only the current needs, that supports the current needs, but also is scalable to be able to adjust to the needs of the future. I'd like to reiterate some important system elements and accountability as Director Mason Joyner had presented. I think they're crucial here. Independent compliance review panel, including EMS leaders from all county agencies, medical directors, PSAPs, and county leadership. This ensures that we continue to progress. Modernized time standards and clinical performance metrics. We spoke to that. Utilization of data dashboard, real-time surveillance, first watch, first pass. That's that accountability piece that I believe Chair Smith spoke to. Contract language that ensures on-ramps and off-ramps for both county and AMR. I think this is important for a non-expiring contract, is that there's on-ramps and off-ramps for both. All these critical elements are needed to make this agreement sustainable for now and in the future. I firmly believe what we exist and why we're here is to save lives. That's why we're here. I understand what Doc Sani was saying, and a lot of what we respond to is spot on. What he was saying was spot on, but time is the essence, okay? I just would ask you to hold your breath and see how long you do that, okay? So time is important. I also would just like to point out that as individuals, we do good things. As teams, we do great things.
Thank you, Nick Brown, for coming forward. Up next, Fire Chief Jim Davis. Please state your name. I just stated your title, but where you come from, and you have 3 minutes.
Thank you, Chair Smith and Commission. My name is Jim Davis. I reside in Canby, Oregon. I'm the Fire Chief of Canby Fire and EMS, as well as Chair of the Clackamas County Fire Defense Board. I would like to recognize and thank the consulting firm of Cambridge Consulting stakeholders and EMS partners throughout Clackamas County and the Clackamas County Council for you taking time today as well. The county and all EMS committee members have done an excellent job working and soliciting input from all interested parties and provided throughout the county. The plan is being presented to you for your consideration, provides an effective use of all EMS resources throughout the county. Clackamas County is very diverse, from urban, suburban, and rural. This plan will provide the most effective response for the most urgent type of calls. It provides opportunities for up to EMS calls and many frequent use of the EMS calls. In other words, when people use the system several times, it also addresses that as well and has a plan to help with people that are in need that continue to call through the EMS system. Provides a uniform reporting system throughout the county, and Canby and Molalla support that as well. And the county and the county EMS committee provides input to changes. We have to continuously look at how can we change and improve our levels of service even after the plan is implemented. The Clackamas County Fire Defense Board preference is that the plan be approved and implemented as soon as possible. And thank you for your consideration.
Thank you very much for coming forward. Up next, Matt Dale, please come forward, state your name, your area of residence, and you have 3 minutes.
Good morning, Commissioners. My name is Matt Dale. I'm with Canby Fire District as the EMS Chief. I live in Oregon City, and I'm also your chair of the Clackamas County EMS Council. I want to thank you, this commission, for directing us several years ago to take this work on and bring the product that you have before you. We'd hoped to have this to you before now, but right after we'd started, the pandemic began, and as you know, everything stopped. And I'd like to recognize all the stakeholders. Some are in the room today, others have been noted in presentations, that the majority of this work was done virtually, which is probably not normal for a work of this size. This now, as you know, replaces the one-size-fits-all plan that we currently have. It allows us to hopefully, when implemented, distribute our resources that are often restricted and finite across a wide area of Clackamas County that's often difficult to serve because of its geography. This plan incorporates components that will address all that, as you know, based on successful national plans in EMS. Some of that allows for local fire districts to continue to provide ambulance service, which is tricky to provide service to when it's separated by, vast areas of rural before you get to a very high densely populated area such as Canby, Molalla, or Estacada, for example. I thank you for your time. When your anticipated approval of this project happens, the real work then begins, where we will begin implementing the components of this over an even greater amount of time that will take significant resources, sometimes money, or sometimes training and policies to implement, but we will be here working together to make sure that happens. Thank you.
Thank you very much for coming forward. Up next, Tina Burgess. Please state your name, your area of residence, and quite possibly your position, and you have 3 minutes. Thank you.
Good morning, Commissioners and Chair Smith. My name's Tina Burgess. I'm a resident of Clackamas County. I live in rural Estacada, and I am the director of Lake Oswego's Communications Center. We serve Milwaukee, Westland, and Lake Oswego's police departments, as well as Lake Oswego's fire department. I'm here to give support for the work that's been done and the content included so far in the ambulance service plan and the performance-based ambulance service contract with AMR. This has been a collaborative, thoughtful, and objective project and process. It's involved representation from each of the stakeholder agencies, including myself. The work being done involved regular and continuous joint sessions with all the representatives together to ensure the best service with patient care and citizen safety at the forefront of all decisions. That's all I have for you today. Thank you for your
Tina,
time.
thank you for coming in today. Much appreciated. Up next, John Van de Koevering, please come forward, state your name, area of residence, and you have 3 minutes, sir.
My name is John Van de Koevering. I'm the president of Monitor Rural Fire Department Board, and I come here today to share a couple of concerns. Response time for us, we're on the farthest south west side of the county. In fact, our district covers 35 square miles, of which 15% of that is in Marion County. Our address is Woodburn. You know, we're in that crossover area. But our real concern is the response time that may be affected. We presently are served by Woodburn Ambulance. It's been a very good relationship working with them. Our understanding in the future will be that the nearest provider will be called. And that is really important. But there are some issues. We utilize Metcom as our dispatch center. CCOM is where a lot of the calls come, and there's problems in the handoff between CCOM and Metcom, as much as 4 or 5 minutes. So that's a concern we want to bring to the commission. Going forward, we're not necessarily against this plan, but we're concerned for our residents on delayed times on response. I heard that a number of times today. That's number one. But if that is truly number one, we'll address these issues. The other comment I just want to make is neither I nor any of the board members were contacted for input, although we did have from the county sent out several gentlemen to explain to our board what this was about, and we really appreciate that. Thank you for your work and for letting me know about this meeting. Thank you.
Thank you, Mr. Van de Koevering. I mentioned that because you had in all disclosure, you contacted me earlier on this. Thank you. And I relayed your concerns to the folks working on that. They told me that your board was submitted with this entire plan and that you approved it. So now I'm a little concerned. So would staff like to address this, Philip?
Yeah, I'm going to have Bill Conway, our program manager for our Office
Thank
of
you,
Public
John,
Health and
for
Emergency
coming
Services,
forward.
come up as
Thank
he was our main point of contact working with Monitor Fire.
Good morning, Chair Smith, Commissioners. Bill Conway, Office of Public Health Emergency Services Manager. When we started this, not when we started this, but during the process, we invited Monitor Fire to be a participant in our strategic plan task force. And there was Captain Wheeler, now Assistant Chief Wheeler, was part of our task force and was involved in a lot of these processes. So he was in the know and involved in our process. We did send the 21 recommendations to Captain Wheeler at the time to share with his board. And we also involved them in the process.
Okay. So how can you address what Mr. Van de Koevering says, Metcom versus CCOM? That's news to me. 5-minute delay. I don't know what that means.
And I don't know, can't do a deep dive for you, but what I do know is there were some issues in transferring calls. Don't know where the issues came from, but recently both Metcom, CCOM, and Monitor Fire met to discuss these issues. The fire chief from Monitor Fire was in the meeting where they discussed where the issues are stemming from and came up with, as far as I know, came up with a plan to address those issues and minimize the miscommunication, wherever that may be.
So my question is, if Monitor is located in Clackamas County and all other agencies use CCOM, why are they using a different call center called Metcom?
So, and forgive me if I misunderstand it, but basically, that fire agency is a Marion County fire agency. Even though
But-
the majority of their.
But he
fire-
says only 15% of their service area
Correct.
is in Marion County.
That is correct.
That means 85% is in Clackamas County, and is it their election to be in Marion County, Metcom?
I can't answer that question. I know they are considered a Marion County agency, so they use Metcom, but I can't answer that
We're
question.
going to have somebody come and address that. Please come forward, sir. Yeah, please state your name and position. Thank you.
Hi, I'm Tony Collins. I am the operations manager at CCOM 911.
Okay, do you understand the question or the concern being presented today?
Yes,
Can you comment?
sure. Yes, we actually do have, one of our fire agencies is Aurora Fire that we dispatch for. They are in Marion County, but also in Clackamas County, similar to Monitor Fire. It's the fire agency's choice as to who their dispatch center is. So in Clackamas County, we obviously have two dispatchers. Tina Burgess was up here. She's LOCOM's manager. I'm CCOM's manager. It's the agency's choice as to who their dispatch center is. They contract with a center. So that's how Metcom is Monitor's dispatch center, because they have that center. Marion County also has another center, WVCC, that has a lot of agencies in Marion County, as well as Lincoln County and Polk County. So county lines don't necessarily follow what the dispatch center is. As far as what the issue was, Bill talked about that there was a meeting recently, and there were multiple fire districts there. Bill was also there. People from CCOM were there, and people from, I believe there's somebody from Woodburn Ambulance there. Is that correct as well, Bill?
I think so.
Okay. So we uncovered several things that were incorrect. There were incorrect maps, and this has been an ongoing thing for years. CCOM's maps, Metcom's maps did not match. CCOM has our own internal map person that does our mapping with county GIS. Metcom's mapping is done they have an internal person, and theirs is done with City of Salem. The maps, as far as who was responsible for what, did not match. Now they're going to match. So our agency and Salem are working together to make the maps match. Additionally, and he is correct that calls come where calls come. Cell phone service isn't like the old landlines where they went exactly to the right place they were supposed to go.
Sure.
Cell phones go where they go. So we get a lot of the calls. Metcom gets calls. We transfer calls back and forth. We do have a system in place that is through our CAD, our computer-aided dispatch systems. Metcom uses a different system than we use, but there is a link between the two CADs that we can send information back and forth, whereas we used to just call. Now we can send the information to them on a call if we answer it. And so now we've put in a policy between the two agencies that it's basically whoever answers the calls keeps the call and dispatches the call, so that there isn't the delay of sending the call, then they have to question the call. If we get the call, we question it, we send it to Metcom. If Metcom gets the call, they question it, they send it to us.
So are you saying with the implementation of the new maps, your new technology, that the delay that was previously testified to has been remedied?
I'm hoping that's eliminated. I mean, there's going to be.
It's fairly new, though.
Yeah, the meeting was last month.
Okay, all right, so we're still working on it, getting it going, but you did recognize a deficiency.
Yes, ma'am.
Somebody recognized out there, realized deficiency, and that is outside the bounds of what we're being presented here today. Is that correct, Philip? Correct?
Correct.
All right, thank you very much. Thank you, gentlemen, for coming forward. This is news to me as well. We're going to continue with our testimony. Brian, is it Hendricks? Please come forward, state your name and your area of residence and your position. Thank you.
Good morning, Commissioners and Chair Smith. My name is Brian Henrich. I'm a Division Chief with Hoodland Fire District. I'm also a resident in Clackamas County since the late 90s, or early 90s. I think that Cambridge Consulting and Chief Brown nailed it. The collaboration that we have in the county that's already in place is key. This contract just kind of brings that onto paper. And I thank all of the county staff and all of the EMS council, all of our stakeholders for all the work in this, and it's fully supported by Hoodland Fire.
Thank you for coming forward. Up next, and please forgive me for mispronouncing your name, Mark Oleschlager? Okay, please, sir, come forward. State your name correctly for me and your area of residence. Yeah. Thank you.
Thank you. My name is Mark Oschlager. I reside in Happy Valley.
Great.
I'm the Vice President of the Professional Firefighters of Clackamas County, IFF Local 1159, which we represent over 340 professional firefighters across the county. I would like to thank you for providing me the opportunity to address you today on such an important issue as we move into the future with the county ASA contract and potential partnerships. I would like to also thank the EMS task force for reaching out to our labor groups throughout the county to be able to provide constructive comments and suggestions as the task force works through and finalizes the new ASA contract for presentation. Excuse me. Being able to have all stakeholders present during this time, working together, providing different aspects, and how this affects the different levels of the system is priceless. With attending the task force Zoom meetings and reviewing the information that has been provided by the consultant company, this will be the first the ASA metrics is not just predicated on response times only, but also adding patient outcomes. With this data, we are able to hone in on our skills and provide efficiencies and high-quality level of care to our community members that access the 911 system throughout the county. With the new metrics within the performance-based contracts, we share some concerns we as stakeholders would like to bring forward. The first concern we share is the KPI credits to the franchisee that are performed by the public agencies, the fire departments. Across multiple counties, we are seeing an increase in ambulance response times, which causes an increase of on-scene times. In turn, leads to more advanced life support care provided by the fire department personnel. As currently written, the KPI credits would go directly to the private provider from start to finish and not truly represent the care that the private provider has rendered. Per the recommendation, the KPIs that are met under each section create a credit to help offset late ambulance response time fines charges to the franchisee. We believe this would create a system that leads to longer wait times for ambulances serviced by allowing the private provider to receive benefits of credits along with longer and longer response times with no checks and balances. Response times for both fire departments and franchisees are there for a reason. We don't believe that it is appropriate to offset fines with public agencies that are funded by our community members to decrease the fines to franchisee, which is a publicly traded company. We would recommend one of two solutions. One, the KPI credit begins for the private provider only after their arrival and any outcomes from the ambulance provider care is based on interventions that they rendered. Second, the KPI credit system is not used at all in the proposed method as it lends to create for longer wait times and would ultimately cause more resources from the public agencies to supplement the private provider. The second concern we have is the recommendation of a two-tiered system, the ALS-BLS ambulance. When a BLS ambulance arrives on scene, the patient transitions from a BLS patient to an ALS patient. There is one of two ways which the incident matrix would lead. One, to call for another ALS ambulance, which could increase the response time to the scene. Or two, the fire department puts a paramedic on the BLS and takes the sole responsibility of the ALS transport. Calling for an ALS ambulance would lead to longer wait times and not be conducive to the best patient outcome for most patients. The second option leads to the fire department crew resources being regularly minimized, which leads to longer response times throughout the county jurisdictions, which includes both ALS care and fire protection services. If you can imagine, a paramedic on a fire engine in Beaver Creek is utilized as an ALS provider on a BLS ambulance. The sole paramedic on the Beaver Creek fire engine is now gone to the hospital for 1.5 to 2 hours. The fire engine is now reduced from 3 personnel to 2 personnel, and they no longer can provide ALS coverage and are limited on fire protection services to an area over 40 square miles. Although this is not a new system, it would be new to Clackamas County, and there would be much to discuss prior to implementing. We believe the best solution would be to provide for on-ramps to negotiate the conditions of the portion of the contract prior to implementation. This is a complex act for any system, and we believe that without proper research and discussion, it may cause long-term peril to the EMS system.
Please finish. I think you've made your point, sir.
Okay. In closing, I'd like to recognize the hard work of the EMS task force and all the individuals involved and the work that's done to get to this point of the performance-based contract. We look forward to continuing to collaborate with labor and the input with the EMS task force. Thank you.
Thank you very much for coming forward. Philip, did the Cambridge report mention the KPI credits?
Yes.
And how was that handled?
So if the ambulance provider is meeting the clinical performance metrics, but they aren't meeting the response times, there is that incentive where they would have a reduced fine. So that is part of what the consultant recommended.
So there is, within the contract, within the Cambridge, they do allow for a reduced fine?
Yes.
Okay. And I'm not exactly sure everything that this gentleman was talking about it, because I've taken, as you know, a deep dive on this. Probably, I've taken a deeper dive on this. I've spent 6 months on this contract, and this is coming out of the blue. However, if we approve going forward with this today, is this issue resolved?
So it's worthwhile to still have discussions about, as I mentioned, the complexity of
During
those.
the implementation process?
During the implementation process and also for the performance-based contract, one reason it's not in the packet is because those KPI indicators are still being looked at. That's like the last piece of the contract that's still, the details of that with the medical directors are still being worked on.
Okay. And then my next question, if we approve this today as outlined in the motion in the packet, what is your timeline for implementation?
The ambulance service plan would go into effect once OHA gives us approval. If we have it before the board in September, the hope was that we would have an adopted plan before the end of the calendar year. Once we receive that from OHA, we're beholden to OHA once they give their secondary approval. And then for the ambulance contract, the contract goes into effect once the board approves the contract with a start date that the board gets to decide. Our staff recommendation is January 1st, 2024.
Okay, so it needs to go to the Oregon Health Authority. After whatever vote we take today, I assume that we're going to go ahead on this just because we need to, commissioners. But there's a couple issues that came up during testimony. Could be worked on during the implementation period, is that correct?
Correct, especially these items that are in the ambulance service plan, because that really sets the future direction of the work moving forward. That is setting the policy intent. The plan is setting the direction for where the EMS system is moving forward, and the implementation is iterative and ongoing.
So you would bring it back to the Board of County Commissioners then? For what?
Bring the contract or the plan? There's two
Well-
deliverables.
Okay, 2 deliverables. So you would come back for the plan
In September.
in September, and then later, when would we vote on the contract?
The contract, our hope is to bring it back before the end of the calendar year, this fall. I cannot set a specific date. We need to finalize those KPIs, as the gentleman talked about. We need to sit down and negotiate the details with AMR. Once they sign it, it will come through the regular board process for approval of contracts.
Okay. In doing so, I don't take our calendar for granted. You need to be very mindful of calendar dates for December and November, because we have a lot of work we're doing, and there's built-in recesses for this board. So if you have something in mind that you think you need to get it to us so we can schedule you ahead of time.
Yes.
Okay, both for September, for the implementation, and secondly, for the contract by the end of the year, if that's what you all seek to do. I have no problem with going ahead with a contract on this before the expiration date. In fact, I think it would behoove us all to have a more seamless operation in our ambulance service to do that. Any other questions, Commissioner Savas?
Yeah, so I turned my light on to be recognized for one reason, but I wanted just to, before we let this go, so Philip, do you recommend that we, the staff recommendation, option 1, where it ends with as presented, do you still suggest we move with option one based on what you've heard and what Chair Smith has just outlined, or would you suggest option two, or just strike the words as presented in option one?
The concerns that were raised during public comment was what I presented and is in the packet. So that's work that is still the final details that are being worked on. So I think that I'm still recommending option number one.
Okay, even with the words as presented?
Yes.
Okay. So I just want to just go back to the testimony and all the work that's been done. I want to recognize, we need to recognize, colleagues, years of hard work, not just the onboarding to Cambridge and that work, but years in the making that made this all happen. This goes back several years of effort and work and focus on improving ambulance service, medical service, all of that on behalf of our constituents. So I've been around long enough to recognize, not understand it all, but certainly recognize all the hard work and dedication a lot of you and your cohorts have done. So thank you very much for everything you've done. I think it's correct that, the collaboration and the effort, I think it's fantastic. I mean, if you really look at the body of work you've all done and the recommendations that are included, this is a great achievement. So thank you for all your good work.
Thank you, Commissioner Savas. Commissioner Schrader.
Yeah, I just want to echo what you said, Commissioner Savas. This is a very complicated system. All medical systems are complicated because there's so many variables dealing with it. And transport is one of those barriers, getting people where they need to be quickly and getting the medical care that they need. And again, I was here when collaboration was not something that was happening back in the day. And I think for me, having the institutional memory and seeing what's happening here today, that the collaboration piece has really driven this process. So I realize that there are issues that are going to have to be worked through with a complicated system, and I think that's on the record. I think we recognize that. I think that all the professionals here in the audience are committed to that, which is a huge milestone in my mind. And I feel as if we could move forward with option one today intentionally with the idea and the notion that a complicated system is going to continually have to be tweaked as we move forward, and that these are the issues that we will move forward. We're stating it publicly. We're getting that information here that will continue to be tweaked and worked on. But there is no perfect there. All there is moving 2 steps forward and circling back to retweak and to reframe the situations, because this is a fluid service, and there's variables and there's uncertainties, and those have to be continually addressed and worked on. I feel very comfortable that the folks that testified here today are all on the same page with that. But that's just my, again, I've been through, you took a deep dive. I was glad you took a deep dive because I didn't want to swim in those waters anymore. I mean, well, I do, but because it's my job, but I've been doing this a long time, and I can see the absolute change that has happened in the process and how things are being pulled forward. Thank you.
Thank you very much. Commissioner West.
Thank you, Chair. Mark, you piqued some of my interest with your questions. I was kind of alluding, I think, to some of it with my BLS, ALS questioning. And so maybe after this, I would love to hear more from you and maybe ask some further questions as we continue this process, and just be available to that. And so thank you for bringing those concerns up. I want to make sure that we try to mitigate any disparities of access to health care as much as possible, and that people get the best quality of care, not just when we arrive there, but then it's the most professional, the most evidence-based type practice that we can give to an individual in a time of crisis. And so, Mark, I think maybe some of your questions have concerns around that, specifically about what's available as a resource in our communities when somebody calls 911. And so I'm committed to continue that conversation beyond this with you, Mark. I'm kind of lucky. I mean, I know historically there has been, we'll just call it tension in this process, and me being the new kid on the block, I love to see the collaboration and the growth with our service providers, our men and women on the front line, and the county commissioners trying to find that common goal. Philip, I think you did a fantastic job helping lead the county through this process, and the rest of the staff, thank you for your hard work in this. And so I look forward to us having more collaboration in the future, addressing those questions that maybe were brought up today to make sure that we're doing the best we can to mitigate those concerns. And it's been, this process started before I was even on the Board of Commissioners. And, you know, it's really an honor to be able to be at this point where a big feat and a big task has been accomplished by a lot of people that have common goals and shared interests, and to make sure that we have a world-class first-hand responders and contracts and infrastructure to provide essential and life-saving care to people. And that's right. That is what this is all about, is saving lives and taking care of our neighbors. And this is an essential core function of government, especially local government. You can almost judge the quality of the leadership within a local government based on how we take care of people in a moment of crisis. When does law enforcement show up? How fast do they show up? What's the quality of care in an emergency? The professionalism within different organizations. And since being a county commissioner, I am really, really proud across the board of the men and women and the policies and the infrastructure that we have set and the modeling and always trying to improve here in Clackamas. So it's an honor to partner with you guys, and thank you for the work that you do. And it sounds like there's going to be some additional tweaking and questions answered as we move forward. So I look forward to that continued work.
Thank you. Commissioners, at your desk, you have a letter from Kaiser Permanente, and the hospitals have also participated in this. Especially number 5 is not recommended for inclusion because the hospital systems do not support this change. And Philip, in this letter, recommendations 5 and 6, we strongly agree that staff, quote, a comprehensive market allows for flexibility and more cost-effective resources. I believe that was taken into consideration. And the other paragraph, we also appreciate the mention in recommendation number 16. The county is actively working on a relationship with our hospital partners. Also in the contract, it also allows for transport of a different agency, a different company, correct? And that practice will continue because obviously AMR can, and I'm talking transport from the hospital to another facility. I'm not talking emergency services. And so that will stay intact as well. The commissioners, I was here when we did this last contract, and it was not one of, I felt, my brighter moments as a county commissioner. So when this came to me, I vowed to rectify any abnormalities or deficiencies or political processes that could influence this. So that's why I spent an inordinate amount of time, not only with our staff and you and Bill Conway, but also anybody out there who has an interest in performing this work, mainly with AMR. And I went to Metro West. And I will say this, from the last time that we approved this contract, there's just not that many ambulance providers left. And so the competition for this has really diminished over time because, frankly, they've gone out of business. They have gone bankrupt. And in 2016 or 17, when we put this out for bid, one of those companies went out of business. And Metro West isn't even interested in bidding on this contract. So we need to keep that in mind. And the profit margins aren't as great as what you might think they are on this, because we know what's happening with inflation. We know what's happening with workplace issues. Gas is increasing. Everything we do, every touch point that this ambulance contract deals with is an increased cost. So today, we're not going to address the fine, but I'm going to highly recommend that we do reduce the fine and help them with their workforce and training and bringing more people on, not just to meet your minimum standards, but for a backup in case something happens, because we need to be that responsive. Lord help us if we have another firestorm. Lord help us if we have another catastrophic emergency and we don't have people to take care of the people who are in need. That is our main goal, is to make sure that ambulance services and medical emergency services arrive to the people who need them. And I want to thank everybody involved in this today. And I really like the color-coded chart here on all the 20-some. Yeah, and that was, I says, can we do the colors different so I can understand them? So just to make it easy for everyone, and I read each one of these aloud, and I says, what does this mean? I don't understand it. And I've got a file in my office on responses to every single one of these 21 recommendations, that this person said this about 21, this person said this about number 21, this person said this about 21. Commissioners, and it's welcome anybody who wants to read it. So I think we are at a good place for today. So I will entertain a motion to accept option 1.
I move to approve option 1.
Second.
Thank you, Commissioner Savas. He has made a motion to approve the contract.
Sorry. Sorry.
Commissioner Savas has moved that we accept the motion of this contract, or this plan that has been presented, and knowing that we'll come back, and Commissioner Schrader has seconded the motion. Further discussions?
Yes,
Commissioner
Chair.
Scholl?
Yes, Chair. For the people in the room, option 1 is to instruct staff to finalize the performance-based ambulance service contract with AMR and to finalize the ambulance service plan as presented today. Thank you.
Thank you for the clarification. Any further comments?
Yeah, just Chair, all the concerns that were raised, as Phillips assured us, will be addressed. So I want to make sure that's our clear intent.
Well, the clear intent is, Commissioner Savas has been said numerous times, they're going to come back in September with the plan, where certain aspects of this, the issues that were raised today, will be mitigated. And then at the end of the year, we'll come back for the contract finalization. So we will have 2 more bites at the apple, so to speak. If any commissioner has a concern about anything that was said today going forward, you need to let Philip know about that and what is being done about that. Because I don't want to come back here in September, oh, I didn't know, or I don't understand. The onus is on each commissioner to understand this contract going forward, because it's one of the biggest economic approvals we will do, and it is our charge according to Oregon law. Tony, please take the poll.
Commissioner Shull.
Aye.
Commissioner West.
Aye.
Commissioner Schrader.
Aye.
Commissioner Savas.
Aye.
Chair Smith.
Aye, motion passes 5-0. Thank you, everybody in the room, for coming today. All the hard work was done, and we look forward to our next meeting. Gary, we had another policy session scheduled for today, but I think we're going to postpone it.
We'll reschedule it to next week, yes.
Thank you very much, Commissioners. You did good work.
Sorry, I was distracted.
Sorry.